Ladies and gentlemen, welcome to Sound Leadership with DJ. It's time to buckle up and get ready for an episode that is going to be an absolute blast. Today, we have an incredible guest joining us today, someone who has truly mastered the art of leadership, Jacob Maurer. Not only is Jacob a highly proficient captain in the United States Army Reserve and a team leader on the Airborne Civil Affairs, but he is the CEO. Guys, listen up. He is the CEO of Kakua Healthcare. This guy is the definition of a leader, and we are thrilled to have him today. Jacob's extensive experience in various healthcare fields make him the perfect person to give us some insightful, invaluable educational leadership. In this industry, it's ever changing. So, this podcast is for those who are in healthcare, thinking about joining healthcare, or simply interested in the dynamics of leaderships. From managing diverse teams to navigating complex regulatory frameworks, Jacobs has a wealth of experience and a wealth of knowledge in leading successful organizations. His excellent interpersonal communication skills and organizational savviness makes him the perfect guest for today. So sit back and get ready to learn and grow from the best in the business. You won't want to miss this engaging and informative conversation with Jacob. So let's dive into the world of leadership. Welcome, Jacob. How are you doing today?
Great, great. Thanks for having me. Really appreciative of being
Hey,
on the
man.
show and talk a little bit about leadership.
Man, I am excited to learn about your journey. I'm excited to learn all about you. So, I did a mini introduction, but tell us who Jacob is.
Already, yeah, be happy to. So I'm a United States Army officer. I'm a licensed nursing home administrator, and then I'm the CEO of Kukua Healthcare, which is a licensed home care agency in the state of Hawaii, specifically on the island of Kauai. Just got into healthcare. I went to Baldwin Wallace University. I got my degree in healthcare management. I enlisted in the Army Reserves and then took a ROTC scholarship through the Army Reserves and commissioned as a second lieutenant in the United States Army. Shortly following that, I went to my training as a quartermaster officer and deployed to Afghanistan with Special Operations Task Force in 2017, working with the Operational Detachment Alphas, which are ODAs, Green Berets, going behind enemy lines. We were fighting ISIS in 2017. I did humanitarian assistance missions with them for around 7 months. Came back and went to airborne school, parachute rigger school, and was a parachute rigger officer for a few years. Shortly after getting off active duty, I did my AIT, which is Administrator in Training Program in the state of North Carolina, with an individual by the name of Jonathan Wade. So it's basically a 9-month unpaid internship where you get the skills needed to take your state boards and national boards to become a nursing home administrator. So did that in 2018 and got my license and was working for Laurel Healthcare Company as an administrator, also while being in the Army Reserve as an Army Reserve officer. So traveled throughout the state of North Carolina in Raleigh and Asheville, and then back to Raleigh, and took a job to move to Hawaii, and then was on the island of Kauai for a few years, working for a nursing home company on the island of Kauai, and most recently, transitioned to starting Kukua Healthcare, as well as advancing in my military career. So just have had a wealth of experience in long-term care and skilled nursing, in the military, specifically in the special operations and airborne communities, and excited to go on this new journey to start Kukua Healthcare, which is in-home based services. So we're just starting out. We've been about a year of us getting all of our documents together and getting our licensure. So really excited for what's to come as we expand and grow, and excited to continue to serve my country in the Army Reserve. at the same time. But, definitely have had a lot of experiences in leadership over, working in long-term care through the pandemic, as well as, in combat and at home, jumping out of airplanes, leading paratroopers. So just, have a wealth of leadership experience and working in different groups in healthcare and in the Army. So.
Wow. Well, first, let me say thank you for your service. I'm in awe by your journey, right? And your journey in healthcare. And, some people may see me and they may see the aloha shirts I wear. So, aloha from afar, right? I'm on Oahu and you're on Kauai. So, aloha. And just thank you for all you have done. I'd like to dive right in because you have an extensive leadership journey, an extensive leadership background. I want to talk about leadership. What is leadership? What is your definition of leadership?
So I think it's the ability to influence a group of people that you work with to accomplish a mission, whether that be in healthcare or the military. So I think your ability to influence and train and mentor your subordinates and work with different groups to accomplish a common goal or mission. In healthcare, that's providing good care to residents, and in the military, it can vary, but whether that be evacuating civilians or jumping out of airplanes and keeping paratroopers safe. But your ability to influence those people and guide those people and mentor them to accomplish a common goal. So,
wow. I think it's very insightful. And you said something, and I want the audience to understand what you're saying. Jumping out of airplanes. So when we talk about leadership, I'm sure there's a great deal of stress when it comes to dealing with jumping out of airplane and leading teams to jump out of airplanes and getting your man down successfully. So how do you lead a team to jump out of an airplane and lead them to the ground safely? How do you do that without, cracking under pressure, for lack of a better word? How do you lead a team in a stressful situation, such as jumping out of airplane?
So, in the airborne community, those that lead people out of airplanes are jump masters. I'm a jump master myself. Basically, you are involved in a community and you perform a mission, which is jumping out of airplanes, and you go to a school where you become very highly proficient in all tasks surrounding airborne operations, inspecting the parachute, ensuring they're going through the proper sequences. So the planning and preparation, and then your expertise in the craft. So before every airborne operation, you go over all the points of performance from exiting the aircraft till you land. You recite that verbatim, on a stage to the people that you're going to lead out the airplane, and ensure that they're highly trained, as well as going through actions in the aircraft, what you'll do prior to, and you go through this whole pre-training, train up the day before or right before the airborne operation, and you ensure that they're proficient. You identify if there's anything that they're doing wrong and call them out, ensure that they're trained or need to be retrained prior to exiting the aircraft, so they're not a hazard to themselves or those in the airplane. Go through the rehearsals, you inspect their parachute as the jump master, and then you do what you practice in the aircraft, and exit the aircraft safely, and make sure all your paratroopers in your aircraft exit safely. So that means having key senses of if they're unsafe to act. So, but yeah, it's I think a lot of the same concepts in the military apply to healthcare as well. If you're you're training how you fight, if you're preparing for a survey, or if you're preparing,
I like that.
If you're not practicing your craft, whether that be caregiving, direct patient care, or your business office isn't trained on how to submit for reimbursement, it's the same concept. If you practice, you get training, that. And then you can you can execute and be successful as a team. But if your paratrooper, if you have one paratrooper that stops in the door or isn't doing something safely, the same goes if you have one caregiver that's maybe not treating residents good. it can impact the whole team, the whole aircraft, or your whole facility. So just ensuring that everyone's on the same page, and it only takes one person to, affect, your facility or your aircraft for doing something wrong. So just if there is someone that needs to be retrained, or give that to them. And then ultimately, if you're unsafe in an aircraft, you shouldn't be in the airborne community. The same goes for in a nursing home. If you're not treating residents with respect and dignity, or leading your staff, or they're not doing the right things, then they shouldn't be a part of your organization and taking care of our elderly population. So same concept. I think of leadership is leadership, no matter if you're jumping out of an airplane or providing care to our elderly population. So
Wow, profound, and I love how you relate the two, and you show how you can mirror your experience in the service to now your experience in healthcare. So I'm sure, just like the service and just like healthcare, you deal with difficult members and difficult team members who are maybe not performing to the best of their ability. How do you, as a leader, inspire, motivate, and coach in times of distress? So, you mentioned in your previous statements that you went overseas and you were fighting ISIS. Well, then you came back home and you fought COVID. So how did you motivate and inspire people in both situations?
I think, both situations in the beginning, there was ultimately, you're caring for people. Lives are on the line in healthcare. It's not the same of, bullets flying around you, or, IEDs in the road, but, we had a virus where, we didn't know what it was or how it could affect us. But I think the same thing, preparing your team. If someone's not meeting the standard, I think I really value what I've learned in leadership in the military is people respond. So when they're, taken to the side, explain what they're doing wrong and how they can fix it, and then giving them opportunities to correct it, rather than, saying, remarks in group settings. If someone, doesn't do something as they should, the same in the military, the same in healthcare. I think if you pull people aside and educate them and train them, and give them the opportunity to learn from their mistakes and know what their mistakes are, you'll better themselves in the team. Ultimately, sometimes there's some people that shouldn't be a part of organizations, whether that be airborne or healthcare, and you give them enough opportunities. But if they're holding your team down, there's lives on the line in healthcare, there's lives on the line in the military. So you can't have them potentially affecting lives of others. So I think giving them all opportunities, providing training and education and retraining, and making sure they're aware, because if someone's not aware they're making a mistake, how are they supposed to correct it? So
Powerful.
I think it's the same, not, some people get this perception in the military that, it's knife hands and Full Metal Jacket screaming at people. And that's not how people are. Sometimes you have to, when there's, if say, you're in the facility and there's an abuse or, a tornado, you're going to probably be running and yelling, maybe not at people, but just to keep everybody safe. The same in the military. Sometimes you do have to be assertive and take charge. But most of the time you can talk to people and just treat people how you'd want to be treated. So
That's powerful. Treat people how you want to be treated. If that's not saying a lot with such little words, right? Treat people how you want to be treated. So how did you learn to be an effective communicator? I'm sure you weren't always best at communicating and getting people to follow your orders and follow what you want them to do. How did you learn to communicate?
So, I mean, both in the military and healthcare, I think it's stating what you want to state. I think keeping meetings brief, making sure you tell people what needs to happen, and then, making sure that they understand what you're saying needs to happen, questioning them, following up, making sure, everyone's on the same page, and then, following up, and making sure that communications, if it's followed up with an email or followed up with some sort of forcing function to ensure that they know that that these things need to be accomplished, and that you're in the loop on everything. As a leader, you're never going to be an expert at everything, but I think if you understand everybody's function, where they're supposed to be, and can follow up with them and provide support, to them, you're going to be able to, because communication, if you can't communicate, you can't lead, in my opinion. So I think it's the basis of everything, is being a good communicator. So.
Wow. Jacob, you're dropping knowledge to the audience, right? If you can't communicate, you can't lead. So I think that's really important, and that's a really important things leaders have to have. They have to learn how to communicate and be an effective communicator, and understand that everybody takes communication differently, right? So you are the sender, but you have to make sure the receiver is receiving it the way that you plan for them to receive it. So I think that's an important trait. So as we talk about leadership, is there a time that you failed as a leader, right? Because we're going to have people watching this podcast who are thinking about getting into leadership, but they're scared to fail. Can you tell us a time that maybe you failed, or maybe you missed the mark, right?
Yeah. I think in preparation, I think something I can think of specifically is when COVID started, we really didn't know how to react. I think, I think the planning and the kind of looking around, I think we could have, I know myself, I could have acted more quickly on, say, the PPE stuff. And just, I think sometimes you fail because of your failure to act rather than, just make a decision. Sometimes you may be wrong. But I think in highly stressful situations, a decision is better than no decision at all. So I think sometimes where I feel like I have failed is overthinking or over analyzing situations, and in turn, you lose out on precious time, whether that be during COVID or in the military. If you don't act quickly because you want to do research or whatnot, you may lose out on opportunities or fail in general if you don't act. But just understanding when it's appropriate to do that and what type of situations you need to just go ahead and make a decision. Surveys in the door at a nursing home, you're not going to analyze what survey is going to look at for all the days and not make decisions. You got to, if you see something you feel is wrong, you got to make a decision. And the same goes for your staff too. Sometimes they'll make a decision. It's maybe not the best decision, but I think making a decision sometimes, even if it's, not the number one, it's better than nothing at all. So I think times I've failed is overthinking or overanalyzing, how I'm going to get through a situation rather than just, and I think doing that through COVID and the military, has made me just, act appropriately with appropriate time constraints based on the situation. So that's sometimes I can feel like, areas where I've failed. It's just, sometimes you just gotta make a decision and accept the consequences, especially in highly stressful situations, whether that's like a pandemic or, in a firefight, and you're going to always look back. You're always going to look back as a leader and say, oh man, I could have done this different. But but if you're sitting in your foxhole, not doing nothing, or sitting in your office as an administrator, just wondering how, thinking about how you're going to make through it, I think initially not making this, and then I thought about it, it was about a weekend. It's like, okay, let's just pull the trigger on masks. Let's get masks. I got a bunch of shoe covers thinking that was going to do something. And, sometimes you make mistakes when you act, but I feel like at the end of the day, if you just make a decision, as a leader, it's going to be better, for your organization. And then if you do make a mistake, I think, accepting responsibility, and not passing blame.
Yes.
I know, especially as a younger leader, sometimes you're quick to, figure out reasons why it happened, but ultimately you're in charge, whether you're an Army officer or you're an administrator. And I think as a leader, your staff respects that. It's like, man, he said the reason the residents weren't well taken care of on the hall is because of him. Like, man, and it's probably me, but ultimately as a leader, you're in charge of what does and doesn't happen. So I think always taking accountability for mistakes in your facility or your unit, and then when you do good, I think passing the the kudos down to the lowest level. Leadership's a thankless job. I think if you recognize, and then in turn, you have to feel like your organization will be successful if you do those things. And sometimes I feel like leaders get stressed out about how their bosses or leaders will view them if they take ownership of everything. But I've always be like, it is what it is. Mistakes happen, but I'd rather have my team, respect and value me because I'm going to take ownership of everything. And ultimately, you may take ownership of everything but I think at the end of the day, you'll be more successful throughout your whole career, work for different organizations if you accept that responsibility as a leader for everything, because you are responsible for it. You could have done planning or preparation different. You could have done things different. So I think just having accountability for your whatever your organization is. So.
Wow. No, another great response to another great question, right? So you've taken all this leadership that you have and you put it into starting your own organization. So tell us a little bit more about your organization. What does it do? What's its mission? What's its purpose? And how does your leadership vision, your strategic vision, make your new venture successful? What's going to make it successful based on your leadership vision and your strategic vision?
I think the reason I started Kukua Healthcare, Kukua means help without expecting anything in return in Hawaiian. And, as an administrator, specifically in Hawaii and the island of Kauai, you don't have the resources you do on the mainland. And I saw a problem of my patients people discharged from the hospital and then going right back to the hospital or nursing home. And there's only 2 organizations on Kauai right now that are licensed home care agencies, Master Care and Baiata. And there's 76,000 residents, and 22% of them are above 65 right now. So you're looking at 15,000 people that potentially, that are growing and aging, and that population's getting bigger and bigger every day. So, I looked and I saw an issue, and I saw, people struggling to get the resources they needed at home, and knowing that when you're a nursing home administrator, most of the time, if your residents or your guests have a home, they want to go back to it, and everyone wants to be home as long as possible. And knowing that, and knowing Hawaii's value of being around your family and your ohana, I think I saw that and saw the need, and then started this organization with the vision to let people age in place as long as possible. I'm partnered with Iris. She has her MSN. She's worked in long-term care on Kauai for a very long time. She also runs the CNA school, West Kauai CNA. So, we have a good network of caregivers, and just our mission is to get out in the community and service them. And specifically being a veteran, I'm trying to work with the VA as well, take care of our aging veteran population on Kauai. So it just started out of identifying a problem, and then just seeing that there wasn't a lot of solutions. So I felt like myself, along with Iris, with her, and the biggest barrier right now in the state of Hawaii, I think in healthcare right now, is staffing. So, but in order to have better staffing, you need to grow the workforce. And I think that, working with Iris and just our connections, I think we can make an impact on a lot of people and keep people home as long as possible. So just we plan to grow and grow throughout the island, service as many people as possible, and potentially throughout the state. But right now we're non-medical, so we provide personal care and homemaker services. Eventually, do plan to expand and do skilled nursing and physical therapy and health as well. So a lot of exciting things planned, but one thing at a time. We just got our license here on March 27th, so it was about a year process to put together everything, all the policies and procedures. But we're super excited to get out in the community and just make an impact one client as a time, and keep people out the hospital and keep them home. Make sure they have the resources at home. So just saw the need from my job, and hopefully we can start an organization that just helps as many people as possible. So
no, and it speaks to you as a leader, right? Here it is. Jacob jumps out of planes for a living, right? You're not afraid to tackle a scary situation, and for many people, starting a business on a remote island, right? As you talked about the workforce and some of the other challenges you have, that's a scary thought for them. And many people are scared to go into leadership because they don't know what to expect. So, as we get ready to close this interview,
you there, DJ? Hello?
you there, Jacob? Yeah.
You hear me?
Yep. Sorry about that. That's the joys of being in a high rise, right? And
No, you're all good.
So I'll edit that pause out, and we'll go right to this last question.
Yeah.
You ready to zoom? Okay. Well, Jacob, man, you have jumped out of airplanes. You have done some scary stuff, and when we talk about leadership, it's that, right? Leading in the face of darkness, right? And a lot of people are scared to move up and advance their career because they're scared of darkness. They're scared of the unknown. So as we get ready to close this interview out, what can you say to the people who are scared to go into leadership or scared of the unknown? What advice would you give to an inspiring leader?
Take the hard positions. The hard roads, the less traveled. But I think at the end of the day, if you reach out to people and you take those tough positions, you learn the most. Anybody can take an easy job and go a 9 to 5. But I think when you accept positions of increasing responsibility and then continue to grow and learn and better yourself, you'll just open more doors for yourself in your career. And you'll learn enough, or maybe one day that you can, whether that be healthcare or any other industry, if you are passionate about a career field, just take and learn and grow, and learn what you would do different, and latch on to a mentor, whether that be in healthcare or whatever your industry is, someone that you aspire to be, and learn from them and have that good relationship with them. And just grow and just keep taking positions and of increasing responsibility, and always take feedback from, if you're in a leader, always take feedback from the lowest level, because a lot of times the people working on the front lines, whether that be a soldier in a foxhole or a caregiver providing care to a resident in a nursing home, most of the time they have great ideas. It's just asking them and then implementing it. And I think if you can grow and lead and then take care of your staff and let them grow and take positions and learn from them and let them lead the organization, you can, the world's full of endless possibilities. So I just would say, always take care of your people, value your people, put good people in management positions, and then let them grow. Even if that means they take a step back from your organization and go somewhere else. Just because you're losing a good person doesn't mean that they won't come back one day. But I think if you just take care of your people and then let them grow, your organization's going to thrive, and then you're going to thrive as a leader. And when you take care of people, because you could be the best administrator in the world, but if you don't you're not taking care of your people and putting good people in your management positions, then you're gonna fail. So I just value your staff, take positions of increasing responsibility, and just continue to learn and then learn from your mistakes. So, you there? Shit. I think it was like the end. I think I was saying it was pretty good, man. I was kind of going around the robin again, so